Many people seem to believe that the COVID vaccinations are free, a generous gift from the government or the pharmaceutical industry. Definitely not. They are paid for by the taxpayers' hard-earned money, both vaccinated and unvaccinated taxpayers' money. We should be asking ourselves several questions. We're supposed to be in a state of emergency, looking after the interest of public health. So why are pharmaceutical companies allowed to make billions of dollars profit from a global state of emergency and taxpayers' money? Why are we continuing to vaccinate when these injections have not performed the way they were originally promised? May I remind you of those false promises and the actual truth. They promised the vaccinations would be a game changer and would restore freedom. They also promised it would render your immunity. Though the truth is, you still contract and transmit the virus, and it only temporarily reduces the symptoms of the disease. They originally promised 100% efficacy, but it's proven not to be this efficient, and the efficacy wanes dramatically after a few months. They promised it would be safe, though just in Australia alone, there have been over 75,000 reports of adverse reactions, serious injuries, including 595 deaths following the injection. The American Vaccine Adverse Events Reporting System shows more deaths have been reported in the past 9 months following COVID-19 injections than all other vaccinations combined over the past 10 years. According to Dr. Peter McCullough, who has participated in more than a dozen clinical trials throughout his career, says most medical trials would be withdrawn for review or more than likely terminated after 10 deaths occur. Why is this real-life trial not being revised or terminated? In addition, absolutely nobody knows what the long-term side effects will be. When we buy a product that doesn't fulfill its promise, we complain, we return the product, and we get refunded. Instead, our governments are ordering even more injections. The Australian government has invested over $5 billion. This is 151 million doses, which is enough for 6 doses for every person in Australia. These billions of dollars debt are going to be paid back by you, your children, your children's children, and probably their children's children too. This is for a disease that in Australia has had very similar mortality rates to a seasonal influenza. There has been a massive scale propaganda about this virus and the injections. We have annual flu epidemics, and we normally take these deaths in our stride as a society. Let me share with you some of the official numbers. In 2017, there were 200,000 cases of influenza, more than 10,000 hospitalizations, and 1,180 deaths. In 2019, we had 300,000 cases, 4,000 hospitalizations, and 902 deaths. In 2020, we had 21,226 cases, 15 hospitalizations, and 37 influenza deaths. In 2021, we had 584 cases, 1 hospitalizations, and 0 deaths. Let's compare deaths caused by influenza to that of COVID-19. During the years 2016 to 17, we had an average of 727 influenza deaths per year. In 2018 to 19, averages were 525 deaths per year. In 2020 to 21, we had an average of 18 influenza deaths per year. COVID-19 deaths from 2020 to 2021 was an average of 720 deaths per year. We have essentially replaced the flu virus with the COVID virus and paid billions of dollars to do so. As of August 31, 2021, only 8 of 674 COVID deaths were suspected but not confirmed to be caused by COVID. 72% of COVID deaths had pre-existing chronic conditions certified on their death certificate. If the real COVID deaths are so low, how can this be the most dangerous of all viruses? And did you know that still today, October 2021, SARS-CoV-2 has never been isolated or purified by science, despite offers of rewards of 1 million euros. We haven't even begun to look at the financial as well as the psychological repercussions this has caused society. Why are we gambling yours and future generations' money as well as livelihood on products produced by pharmaceutical companies that are released of all liability for short and long-term side effects? This is the perfect position for a pharmaceutical company to put profit before public health. When the vaccines haven't delivered what they originally promised, shouldn't the strategy be revised rather than continued? We could be focusing on sustainably strengthening potential host immunity. Rather than spending billions of dollars on even more injections, we could be modeling several countries effectively repurposing Nobel Prize winning medication that has been used safely for 40 years. These alternatives are proving 80 to 100% effective at heavily reducing COVID symptoms and keeping people out of hospital. Though pharmaceutical companies wouldn't be making billions of dollars profit from these protocols. Maybe that's the reason why these treatments are being censored and even banned. Countries that are successfully treating COVID-19 are Japan, USA, India, El Salvador, Brazil, and Africa, and many more. It's our legal right to decide what medical treatments we partake in or not. Yet the Australian government has tried to convince us that there are no alternative treatments and even remove doctors' licenses if they try to use other alternatives. We are supposed to just wait at home sick until we have no option but to go to hospital. This just doesn't make sense. Instead, we're going to do even more injections of the same thing that didn't really work the first time. It couldn't be more contradictory. It's like slapping common sense in the face. Though this is obviously no longer an issue of our health authorities. It's a harsh and die-hard business deal between political leaders and the pharmaceutical industry, and definitely not in favor of you and I. Our government leaders all over the world are not being transparent as to the content of these contracts they have with pharmaceutical companies. Why are the general public and even political members not permitted to see these contracts? These contracts probably restrict our governments from using these cheap alternatives to treat COVID. Believing a pharmaceutical company wants to eradicate disease is like believing an ammunition company wants to eradicate war. Knowing all of this, we need to be asking, what's the real agenda of our governments?